This is going to be a mostly fun event. We do a lot of political events where we're trying to encourage a political official to do the right thing. This is a lot more fun because we're going to thank a political official who's done the right thing and has done the right thing over and over again in his tenure in the Senate and even before that. Not only did he vote to save Medicare and Medicaid last week, but he's been a big proponent of the Affordable Care Act, and before that of child health care programs and many others. It's not entirely a fun thing because we had to have a vote on saving Medicare and Medicaid, and that's something that really shouldn't be happening. There shouldn't be threats to a program, two programs that are critically important, not only to seniors, but to low-income folks, to folks who need long-term care. So first I want to introduce Dorothea Wilson, who's the president of the AFSCME DC 47 retirees, and who's speaking today on behalf of the Alliance for Retired Americans.
Good afternoon. We want to say thanks to Senator Casey for stopping that RINE bill, which would have been detrimental to us. Medicare would be no more like we see it today. Then you have a insurance. It would be like a program that you'd have to go to your insurance company. Now we know what insurance is all about. You pay your money, then they'll say, well, that part isn't included. Then you go to the old folks' home, and then they'll say, well, you didn't have enough Medicare. Or then you put you in a place where a little room, little dark corner, and you have been working all your life, and this is your end. And Senator Casey, we want to thank you, thank you, on behalf of the Pennsylvania Alliance for Retired America, for your recent vote against the budget plan put forth by Congressman Paul Ryan and by the Republican majority in the United States House. We'd like to present you with this thank you card for protecting us. And at this time, I would like to read you a few of the letters that came through. He's going to get more letters. Just like we got mail to stop Ryan, he's going to get mail to tell us thank you, thank you, thank you. Tell him. Dear Senator Casey, thank you for standing up and defending Medicare. I and millions of other seniors across the state are dependent on Medicare. I appreciate you taking a strong stand by voting against the RINE budget in the Senate. You said that if that budget plan were enacted, traditional Medicare will no longer exist in 2022. Instead, our elderly will get a voucher to purchase private insurance, but the voucher won't keep pace with health care costs. You were correct. I want my son, who has been paying into Medicare, to have the same or better protection than I have. Social Security is a promise by our government that we pay into the program. We will be there for us in the future. Thank you once again for protecting our interests. Sincerely, David.
I want to now introduce Julia Ramsey of Action United, who's going to read a couple of the letters that they received.
Thank you, Philadelphia Senior Center, for having us here today. I'm going to read you a letter today from somebody from my generation, which I think is very fitting. Many people, when they think of Medicare and Social Security, they think of the seniors who are collecting it right now. But the RINE budget would take that whole program apart, especially for people who will be retiring in 10 years. Senator Casey, I'm writing to thank you for voting no on the RINE budget. It's absolutely critical that we protect Social Security and Medicare. It is not feasible to think that after working over 50 years, we must leave our senior citizens stranded and vulnerable. I've worked too hard myself to have my benefits taken away from me. We need more champions like you to ensure we not only protect our current benefits, but move forward to ensure more basic rights. Once again, thank you. Best, Joe. And I also want to present to you these letters that we have collected, and we're going to probably be sending more in the email. So thank you very much.
So without any further ado, I want to introduce Pennsylvania Senior Senator Bob Casey.
Well, thank you very much. I first of all want to express gratitude at this event where we're expressing gratitude. I'm really humbled. I've been a public official in and out of campaigns and in and out of various levels of government for the last 15 years. I'm not sure in all those 15 years there's ever been an event where someone was thanking me and thanking other members of the United States Congress for help. And I say that very humbly, and I also say it because I want to remind myself or remind anyone listening to my voice that I come here as well with gratitude in my heart for what you've done for me. And that's not just an expression of gratitude for today's event, which I thank you for, but I also want to express gratitude for what the people in this audience have done for many, many years, decades in fact, to make sure that we have the kind of country that we do. So when we act to protect Medicare or Medicaid or any other action that I would take to protect those programs, I do it with a sense of gratitude for the work that's been done by people in this audience today. You know, too often we forget that this audience, people here today, you've already sacrificed. You know what it's like to work hard. You know what it's like to save, to sacrifice, and build your country, and fight for your country in some instances directly. So today, when I express gratitude to you, I say it to more than one generation, to the people who fought our wars, worked in our factories, taught our children, built the middle class, built the kind of economy that America has been able to enjoy for all these decades. And of course, as well, we thank you for life and love that you've given to us. The least that we can do, the least that a public official can do, is to stand up against attempts by some politicians in Washington, not all of them, but some, who want to end Medicare as we know it. That was a bad idea yesterday, it's a bad idea today, and it will always be a bad idea. And as long as I'm a United States Senator from the Commonwealth of Pennsylvania, I will fight it, and we will win that fight every time. You know, I thought I recall in the debates about health care, there were some guys and gals down in Washington who were, you know, spewing a lot of hot air. I'm pulling out a report that our committee did just a couple of days ago, the Joint Economic Committee. It's one of those rare committees where you have senators and House members on a joint committee. I just happen to be the chairman of it, so I get to direct some of the research. And I asked our folks to do some research on out-of-pocket costs, the daily costs that Americans have to come up with to pay for health care, or in this case, help pay for prescription drugs. And here's the headline on this May 20th report. It says the following, and I'm quoting, "The Republican Medicare plan, health care expenditures would double for elderly in every state." And that's a number that was calculated based upon if their plan went into effect this year, what would happen in a decade. Here's what it would mean for Pennsylvania. I'll skip to the last page in the state-by-state analysis. And again, this is out-of-pocket costs for prescription drugs. Out-of-pocket health expenses for a typical 65-year-old enrollee in 2022 under traditional Medicare, if we stay where we are, which is the right thing to do. Here's the total amount, $6,100. Not a small number, but a lot less than it would be if we listened to those other guys and gals who wanted to make changes in Washington. That instead of $6,100 out of pocket, it would go up to $12,403. Now, I'm glad we had a third column, because I'm not great in math sometimes, so they did the math for me. Here's what it would mean. Here's the difference, and some of you already done the math in your head. $6,303.27. Now that's one of the effects of what they're trying to do with Medicare, just in terms of out-of-pocket costs. It doesn't even get to the bigger issue of what it means for your care and what it means for you and your doctor and your medical care. So I come here today with gratitude in my heart for so many things today. And you know what it's like to be a member of a family. And my parents taught me that when we're talking about a family, that the family of our Commonwealth, and the family of our country must leave no one out and must leave no one behind. So I'm here today to say thank you, but I'm also here today to say I am recommitting myself to this fight. We're going to get this right. We're going to make sure that we deal with those tough questions, but we're also going to make sure that we're not going to do it on the backs of folks who did fight our wars, who did work in our factories, who did teach our children and built the middle class and gave us life and love. Thank you for your commitment. I'm recommitted today as well. God bless you.
We have one last thing to do, and we have some more letters, and we have brought you some flowers to thank you as well. It was either flowers or a cake, and I know you have a busy schedule. I couldn't figure out which one of those would travel better, but...
This is better than a birthday.
Thanks for coming. Thank all of you for coming. Thanks for staying with us in this fight, not just to save Medicare and Medicaid, but to save the America that, as we know it, the America we love, the America which we're all committed to.